Hello, my name is Jenna Ferreira, and I am completing my Unit 7 assignment for Public Health Administration and Leadership, joined here by my friend Jim. So for the situation, Jim is a new pharmacist employee of the Orlando Public Health Free Clinic, and he had an interaction with an unhoused patient where he made assumptions about this individual, which the patient did not appreciate. The patient was expressing frustration for missing an appointment due to lack of transportation. Jim assumed that the patient was not employed, and the assumed lack of employment was the cause of the lack of transportation, and thus at the fault of the patient. The patient expressed concern to the office manager, and Jim has now been asked to report to the office of his direct leader, me, Jenna, to discuss the situation further. Hey there, Jim. Thanks so much for stopping by my office. I wanted to touch base with you about a concern that was brought to the attention of the office manager at the clinic. The office manager received some feedback from one of the patients, Mr. Smith, that you made some comments that they felt were hurtful. This took place 2 days ago on Monday. I am looking to gather more information to understand the situation. As a leader, I like to ask open-ended questions because I think that is the effective way to communicate. With that being said, what do you recall from your interactions with patient Smith on Monday? Okay, so you remember Mr. Smith, and you said that he came in for a missed follow-up appointment for his diabetes management. Okay. He missed his first follow-up appointment after starting metformin. All right, his blood sugar was above goal, and he should have come in sooner to get that dose increased. Okay, so his blood sugar was above goal. That is unfortunate and definitely not an outcome that we want for our patients. Attending scheduled appointments and taking medication as prescribed is definitely an important part of any disease state management, especially diabetes. Did Mr. Smith explain why he missed his first follow-up appointment? Okay, so you're saying he couldn't get a ride to the clinic because he doesn't have a car and is homeless. He was really mad about it? Okay. And you started to get annoyed because he chooses not to work and be homeless. And if he got a job, then he could just buy a house and a car he wouldn't have this problem. So Mr. Smith doesn't work. Okay, you're saying, no, of course he doesn't work, he's homeless. So I just want to confirm. You confirmed that Mr. Smith's employment status, and you confirmed Mr. Smith doesn't work. Okay, and you're saying no, but it's obvious he's homeless, so he doesn't work. That's why he doesn't have a car and why he couldn't get to his first follow-up appointment. And now his blood sugar is high. And you don't understand why he's mad and when he really should be mad at himself. Okay, Jim, you're fairly new here. You've been with our team for about 2 months now. Our team provides care to a very specific patient population here at the Orlando Public Health Free Clinic. Have you worked with this patient population before? If I'm looking at my records correctly, you were previously in Georgia before, is that right? Okay, so you're saying that, yes, you worked at the Georgia Private Hospital in Atlanta for 3 years as a pharmacist before moving to Orlando? Okay, good to know. I just wanted to confirm. And I genuinely do appreciate your concern about Mr. Smith's blood glucose being elevated and above goal, because like I mentioned before, this is not the outcome that we want for our patients. I understand that you're new to the team here and that this is a new patient population for you. And if you're open to it, I'd like to provide some feedback. Okay, you're open to the feedback. Awesome. I'm so glad to hear that. So you assumed that Mr. Smith was unemployed, but he actually is employed and works full-time at one of the restaurants here in the area. A study performed by the University of Chicago estimated that 53% of people living in homeless shelters and 40% of those folks that were unhoused were actually employed part-time or full-time. It's important that we remember to be curious instead of jumping to a conclusion. We're taught a lot of really terrible and mostly inaccurate stereotypes, and we need to be aware, especially when dealing with our patient population. We all have the potential to see things through the lens of a bias, and our bias can exist without us even being aware. Okay, you didn't know that? You always thought people became homeless because they didn't want to work or they wanted to do drugs. And I hear you, and that is a very unfortunate popular stereotype, but it's not accurate. Lots of working class people become unhoused for a variety of reasons. As you mentioned, addiction can definitely be a factor, but there is evidence that shows wages aren't keeping up with the median cost of living. Federal minimum wage remains at $7.25. So even if someone's working full-time at that wage, they cannot afford the cost of rent. Never mind the other costs of living, such as like car insurance, food, things like that. Oh, you weren't aware of that. Okay. You thought homeless people didn't work. Well, it's important to remember that there are several determinants of health that play a role in the way that an individual experiences the world and their health outcomes. It's our job to consider these when counseling and working with patients. I always recommend asking questions for more information before making assumptions or passing judgment with someone with a different lived experience. Nothing can ever be assumed in medicine or public health, and you never know what information you might learn by asking. And I just want to let you know, Jim, that you are a very valued member of the team. This feedback isn't meant to be discouraging, rather the opposite. Please never hesitate to reach out to me or another team member if you ever have questions about how to best handle a situation here at the Orlando Public Health Free Clinic. We all work best together. Thank you, Jim. And for this assignment, I do apologize that I do not have another person to perform this with, but I do live alone with cats, and I am currently traveling. So thank you for listening to my assignment, and I will be submitting it to the Dropbox with the script. Have a great day.